Medical tourism is another sector the Malaysian government wants to promote. Malaysia is considered to be in the top 5. Traditional destinations in Malaysia for medical tourism include Kuala Lumpur, Penang and Malacca.
Mahkota Medical Centre is right now the biggest private hospital in the southern part of Malaysia. We provide healthcare services in a very wide range of medical disciplines. In fact, we are quite comprehensive. We provide services as complex as cardiothoracic surgery, neurosurgery, to women and child services, to cancer services, to orthopedics, and then many other disciplines as well. We see about 200,000, maybe more than 200,000 patients a year, and 50,000 of them are foreign patients. Majority of the 50,000 patients that come to us, foreign patients that come to us, are Indonesians. But having said that, recently in this year, we've noticed a significant increase of patients coming from Singapore, from Cambodia. Recently, we've got visitors from the hospitals in Korea, Japan, and China, all of whom have been quite surprised at the service standards we provide at Mahkota. And we are right now talking to them and working with them to see how we can get some of their patients to the hospital as well. I think it's a good thing for the local community because in developing this foreign patient crowd, where they tend to go for the more complex surgeries, it will allow us to then develop more complex and sophisticated medical disciplines so that the locals can get to enjoy such healthcare without having to travel to KL or to Singapore. A lot of patients have actually given us feedback that they prefer coming to Malacca because the cost of living is low. They can get to stay in a budget hotel. Their family members who come here could also go to the different tourist destinations. And it's also a more relaxed place for recuperation. At the same point, we are actually one of the hospitals in Malaysia that are accredited by the Ministry of Health Singapore for using the Singaporean residents' MediSave accounts. That to us is a testimony of the services we provide. That's why they're comfortable working with us. Our plan for expansion is fueled by demand, where because of this demand, we have actually initiated plans to construct an expansion to the hospital, such that we will double our capacity within 3 years. Of course, having said that, we will be staffing with more subspecialties of different disciplines to complement the existing pool that we have already in Mahkota. Our main challenge right now is the irony of having to keep healthcare costs affordable to the public because it's still a private business and we still need people to patronize us. At the same time, to increase our service standards to meet their expectations. A lot of our patients now come from big cities like Kuala Lumpur, even from Japan, from Singapore, from Jakarta, and they are expecting us to provide them with services equivalent to that of a hotel. At the same time, the locals in Malacca and in Negeri Sembilan and in Johor have to have affordable healthcare, otherwise they will not be coming to Mahkota. So our key challenge is to meet these two aspects at the same time. So we are internalizing the training for a lot of our staff. We are trying to provide training for our staff, trying to change the culture, trying to make it a more service-oriented hospital. Although it's a hospital where people come to get treated, we try to make their stay as pleasant as possible. We are focused in Mahkota on maintaining our essence in what we are, in what we are good at. We will improve the service standards as the world's expectations increase our service standards. But it's important to know that we will maintain what we are at the core in providing advanced healthcare with good clinical outcomes at affordable rates that the local community can enjoy, the national community gets to enjoy, the international community will also get to enjoy.